What's up, everyone? My name is Landicho, student nurse from National University, and for this presentation, I'm going to present my health teaching plan that is all about bandaging techniques. So, as we go along in this discussion, you will able to know the different techniques that we can use in bandaging. So, now let's proceed. Okay, so after we conduct this presentation, the learner will be able to perform bandaging techniques, identify the different bandaging techniques, recognize the type of bandages, and ideal situation to use it. Okay, so before we start, I hope you all feeling better to learn and to absorb this presentation. Now, let's proceed to the bandaging. So, bandaging is commonly used during accident or emergency. This is a process of covering wound or an injured part. It is a technique used to hold a dressing in place over the wound to control hemorrhage, to secure splint to an injured part of the body, and to provide support to an injured part. So this technique can be performed in life-threatening situation like we used to know performing bandaging technique needs and very extensive care, and we must be trained or must learn first the do's and don'ts and the proper methods to apply in a certain situation, of course, to ease and help the injured patient. And as we go along in this presentation, you will be able to fully understand how it is important to know and when and why to conduct this technique. So before we proceed, let's define what is bandage. So bandage is a dressing material consists of layer or pad of cloth dip that is good for quick healing wounds and muscle injuries. Okay, so bandaging has a lot of purposes. One of the advantage of bandaging is that it can hold dressing and hold pressure when the patient is bleeding to avoid contamination of the wound. And it can also provide support to a specific part of the body, particularly when the patient is injured. Bandage can help stabilize muscle, bones, and joints. And it also provides rest to the part that is injured, and like I said, it immobilizes fracture and dislocation. In addition, when about to rescue an injured patient, it is important to check if there is any dislocation, if that to check if there is any dislocation, and if that occur, we will needing to use bandage to secure movement and correct deformity. And then the bandage is mainly used to hold the dressing and apply pressure to the wound. That's why it's, if you would notice, each medicine kit has bandage. This is to help the rescuer or any individual to administer injured person. So the bandage provides a lot of uses that we can apply to as we face the challenging situation every day. People seem to know a very limited information about this. This will be very timely and relevant to the society, mainly to the generation right now, so we can immediately respond to the life-threatening situation. And now we moving on to the importance. So there are the relevant. These are the relevant points why it is necessary to know the bandaging and how to perform it adequately. So first, of course, it saves lives. It prevents situation from becoming worse. It creates confidence care and encourage healthy and safety living. So as we face life situation every day, we are not informed nor if accident will occur in time. It happened randomly or unexpected in day, even inside or outside your house. Um, Major or minor accident really happen inside or outside the house. That's why it's really important that we know all about this, and this importance will help the patient or your future patient to encourage to learn and practice this method. Okay, so now let me read the principles to you. So these are the principles that we should be remember before and upon performing hand hygiene. So first, of course, we need to perform hand hygiene, wash our hands, and wear gloves if possible. And then assist the victim to assume comfortable position in bed, chair, and support the body part to the bandage. And always stand in the victim to be bandaged except when applying a bandage to the head and ear. And of course, be sure that the bandage is roll firm. And then make sure that the body part is to be bandaged is clean and dry. And assess the skin before applying the bandage for any breakdown, and observe the circulation by noting pulse, surface temperature, skin color, and sensation of the body part to be rubbed. And always start bandaging from inner to outer aspect and far to the end. And then, of course, upon performing bandaging technique, it's important that they always start at the end with two circular turns. And then cover the area 2 inches above the 2 inches below to the affected area. Overlap turns and slightly stretch the bandage. Cover 2/3 of the previous turn. Where possible, if possible, leave fingertips or toes exposed for observation. And the bandage on the outer side of the body, do not and bandage on wound or at the back of the body. Okay, so now these are the common bandages that we mostly encounter, particularly in first aid kit. So you've noticed that if you buy first aid kit, it contain all of these bandages po. That's why ito po lahat yung in-include ko para mas matulungan kayo ma-figure out lahat. And then so the first type of bandages, we have triangular bandage. So we have two common types of this. So you can see on the picture, we have cotton triangular bandage and the gauze type. This has the same use and purpose. They use to secure the dressing and the pressure around the wound or the injured part of the body. This type of the bandage is most commonly used to stabilize ankles and feet to correct deformity of the injured bone or muscle. So next is the crepe. The crepe bandage is made of woven cotton. This is an elastic bandage ideal for long-term bandaging. So this kind of bandage po is mostly ang meron po nito ay yung mga athlete, because this is supports strain and reduces swelling, and it also provide pressure to limb and joint. And of course, we have the ghost or cotton bandage. So this kind of bandage po is effective to maintain the wound clean while allowing to ventilate air. This is commonly used when the patient is under the process of wound healing. And the ghost bandage po come in many size depend on the wound, and it combined with topical medicine that can help to prevent infection. And the last one is the adhesive, or commonly known as the band-aid. So we all familiar with this one, even the non-medical person, because it is accessible, especially in Suki store. And this adhesive bandage is small but flexible sheet material, which is sticky on one side. This protect wounds for further injuries and to avoid bacteria. Okay, so there you go. These are the common types of bandages that we usually encounter. Now, let's proceed. Okay, so moving here at the main topic that will conclude this presentation. Now, let me present the different bandaging techniques or the methods of applying bandages. Okay, so first we have circular technique. So circular, this is used to hold dressing on body parts such as arms, leg, chest, or abdomen. So for this bandaging technique, we can use roller bandage, triangular bandage that is folded down to from strip to bandage. So this technique is chiefly to anchor bandages to terminate bandage. So to apply it, start with apply the end of the bandage to the part of the body to be bandaged. Encircle the body part of a few times or as needed. Each turn directly covering the previous turn, and then secure at the end of the bandage with tape, clips, or safety pin over an injured area. And then we also have spiral turn. So this technique allowed the bandage to fit closely to the skin. This is used to cylindrical parts of the body that are fairly uniform in circumference, such as upper arm and upper leg. And to apply this, make two circular turns to begin the bandage, and then continue spiral turns at about 30-degree angle, and each turn overlapping the preceding 1 by 2/3 that width of bandage, and then terminate the bandage with two circular and secure the end as described for circular turns. And then we also have the spiral reverse turn. So this type of bandaging is mostly required when using non-elasticated bandages. And this technique allows the bandage to fit to the tapered shape of the body part all the way along. In addition, these are used to bandage a cylindrical part of the body that are not uniform in circumference, such as lower leg or lower forearm. So to apply it, begin the bandage with some circular turns and bring the bandage upward at 30 degree. And then place the thumb of the free hand on the upper edge of the bandage, and then the thumb will hold the bandage while it is folded on itself. And then unroll the bandage about 4 to 6, then turn the hand so that the bandage is folded down. And then continue the bandage around the lymph, overlapping each previous turn by 2/3 and width of the bandages. And then make each bandage turn at the same position on the lymph so that the bandage will be aligned. And then terminate the bandage with two circular turns and secure the end as described for circular turns. Next is a figure 8 turn. So this technique is used to limit joint movement of hand, elbow, knee, or foot. So commonly known as turns across technique. So it exerts pressure for joints to reduce sprains, injured hand, and foot. And to apply it, begin the bandage with two circular turns. Carry the bandage above the joint, around it, and then below, making the figure 8 turn above below the joint and overlapping the previous turns by 2/3 and the width of the bandage. And then terminate the bandage over the joint with two circular turns and secure the end appropriately. Okay, so now we are down to last two techniques, and these techniques are only required triangular bandage. So this is necessary to know because we can apply this when we encounter road accident. That's why it is important to know. And then we have here triangular bandage to head. So this this is used to retain compresses of the forehead to scalp. This is technique is only temporary to help the victim to control bleeding or any injury around the head. So to effectively apply this, turn the base of the bandage up to the center. It's based on the center of the forehead, letting the point or the apex fall in back of the neck. And then take the ends behind the head and cross the ends over the apex. And then take them over the forehead and tie them. Tuck the apex behind the cross part of the bandage and secure it with a safety pin if available. And then, moving on to the last one, we have triangular bandage sling. So this technique is used to support injured arm or shoulder fractures or dislocation, and this help to immobilize injured joint. So, a triangular bandage sling is usually made from muslin bandage, but any material does not stretch, such as fatigue shirt, trousers, poncho, blanket, or shelter half can be used. And then to apply this, fold, cut, or tear the material into triangular shape, and then using the triangular bandage, now insert the material around the injured arm so that the arm is in the center. The apex of the sling is beyond the elbow and the top corner of the material is over the shoulder of the injured side. And then position the forearm so that the hand is slightly higher than the elbow. And then bring the lower portion of the material over the injured arm so that the bottom corner goes over the shoulder of the injured side. And then bring the top corner behind the casualty's neck and then tie the two corners together so that it will not slip, and then the nose should fit into the hollow at the side of the neck on the injured side. Okay, so that's all for the methods of bandaging. So now let me present my return demonstration for this one. So this presentation include how to effectively apply or properly apply the bandaging technique that I discussed. So now let's watch this. Good day, my name is Landicho, student nurse from National University, and for this video demonstration, I'm going to present the different bandaging techniques to augment my health teaching plan. Okay, so that's all for my health teaching plan. I hope you learned something. And of course, don't forget to also absorb this presentation, please. And then um, I hope you will educate some of your relatives to know this, because this topic, this technique is really important for us. And this is also help us to educate some people, and to help when the accident or any life situation happen. And again, thank you for watching, thank you for listening, and have a great day ahead.